Hello, everyone. Today we'll explore how epidemiology can empower tribal communities in the Great Plains area. We'll also discuss strategies for building research capacity and fostering effective partnerships to address public health challenges. The objectives for today's session are to discuss the reasons to provide Great Plains area tribes with timely, accurate, and useful data on public health priorities based upon existing data sources and contribute to the effective use of these data. Identify how to build capacity to conduct health research in collaboration with academic institutions, including tribal community colleges and tribal schools, to maximize the benefits of well-designed, culturally appropriate, and ethical health research in Great Plains area tribal communities. Describe how to build and leverage effective partnerships and respond to emergent needs with training and technical assistance to contribute to the growth of public health and epidemiological capacity and excellence within the Great Plains area, especially within tribal communities. Epidemiology is the study of patterns, causes, and effects of health and disease in populations. It's essentially the science of understanding what's happening in a community from a health perspective, and most importantly, figuring out how to address it. For AIAN populations, this work is especially critical because of the stark health disparities they face. Did you know that nearly 20% of AIAN adults report being in fair or poor health? That's almost double the national average. These disparities are driven by factors like limited access to healthcare, historical trauma, and environmental challenges. Why does this matter? Because when we use epidemiology effectively, we can support better decision-making, allocate resources where they're needed most, and work toward health equity. For example, if we know that diabetes rates are rising in a specific tribe, we can target prevention programs and education efforts to address that issue directly. This is why providing tribes with high-quality, actionable data is so essential. Let's now talk about how we can ensure that data is timely, accurate, and useful. Providing tribes with timely, accurate, and useful data is foundational to addressing public health challenges in the Great Plains area. It empowers tribes to make informed decisions, allocate resources effectively, and design culturally relevant interventions that improve health outcomes. Without this foundation, efforts to address public health challenges may fall short. Let's break this down with specific examples and actionable strategies. Timeliness. Timely data is critical for responding to urgent public health needs. For example, during flu season, real-time data from electronic health records or syndromic surveillance systems can help tribal health clinics identify outbreaks early. This allows tribes to distribute vaccines, organize public awareness campaigns, and prevent further spread. Similarly, real-time monitoring of environmental hazards, such as contaminated water sources, can protect communities from exposure to harmful substances. Accuracy. Accuracy builds trust and ensures that decisions are based on reliable information. To achieve this, we must validate data by cross-referencing multiple sources. For instance, combining clinical data from Indian Health Service (IHS) facilities with community-led surveys provides a more complete picture of health issues like diabetes or substance abuse. Inaccurate data can lead to wasted resources and missed opportunities, so it's essential to use validated methods and tools. Usefulness. Data is only valuable if it's actionable and relevant to tribal leaders and health programs. Instead of overwhelming decision-makers with raw numbers, translate data into clear, actionable insights. For example, if data shows high youth suicide rates, create a report that highlights specific risk factors, such as poverty, lack of mental health services, or historical trauma, and recommends culturally appropriate solutions like mentorship programs or traditional healing ceremonies. Existing data sources. Leveraging existing data sources saves time and resources while providing valuable context. The Indian Health Service (IHS) Epidemiology program tracks chronic diseases, maternal health, and infectious diseases across tribal communities. Tribal epidemiology centers, TECs, such as the Great Plains Tribal Epidemiology Center, offer region-specific data and analysis tailored to local needs. Additionally, community-based participatory research engages tribal members in data collection and interpretation, ensuring that findings reflect their priorities and values. By focusing on these 4 pillars, timeliness, accuracy, usefulness, and leveraging existing data, we can empower Great Plains area tribes to make informed decisions and improve health outcomes. Building research capacity ensures that tribes can lead their own studies, address unique health priorities, and sustain long-term improvements in public health. Without this capacity, tribes risk being excluded from the research process or having their needs overlooked. To build capacity for health research, we must foster collaboration between tribes and academic institutions. Tribal community colleges and schools are critical in developing local talent and expertise. Research should always be culturally appropriate and ethical. This means obtaining informed consent, respecting tribal sovereignty, and incorporating traditional knowledge into study designs. For example, a study on diabetes prevention might integrate traditional foods and practices. Training tribal members in research methods such as survey design, data analysis, and grant writing ensures long-term sustainability. When communities lead their research, they gain greater control over outcomes and resources. Finally, focus on questions that matter most to the community. Whether it's addressing diabetes rates or exploring environmental health risks, community-driven research maximizes relevance and impact. Effective partnerships ensure that public health initiatives are sustainable, culturally appropriate, and aligned with tribal self-determination. Without strong collaborations, efforts to improve health outcomes may lack the necessary trust, resources, and cultural relevance. Hence, they are the backbone of public health success in tribal communities. But building trust takes time and effort. Some of the ways to build effective partnerships are listed below. Engage stakeholders. Think about who needs to be at the table. Tribal leaders, health departments, universities, and federal agencies. Each stakeholder brings unique strengths and perspectives. For example, tribal leaders can provide cultural insights, while universities might offer technical expertise. Respond to needs. Tailored training and technical assistance are key. For instance, if a tribe is facing a mental health crisis, partners might offer workshops on trauma-informed care or suicide prevention. Foster communication. Open dialogue and mutual respect are non-negotiable. In today's time, the most successful partnerships start with listening sessions where tribal members share their priorities and concerns. Align goals. Partnership goals must reflect tribal priorities and values. If a project doesn't align with what the community wants, it's unlikely to succeed. Leveraging partnerships ensures sustainable growth in public health capacity, promotes self-determination, and fosters innovation that directly benefits tribal communities. Without these efforts, public health initiatives risk being fragmented, under-resourced, or misaligned with community priorities. Let's explore how this can be achieved through specific strategies. Mentorship programs are a powerful way to train the next generation of public health professionals. By pairing tribal students with experienced mentors, such as epidemiologists, public health researchers, or community health workers, we ensure that future leaders are equipped with both technical skills and cultural understanding. For example, a tribal college student might work alongside an epidemiologist to analyze local health data, gaining hands-on experience while staying connected to their community. Sharing best practices creates a network of knowledge exchange that strengthens collective resilience. For instance, hosting regional workshops allows tribes to learn from one another's successes. If one tribe has developed an effective diabetes prevention program using traditional foods, other tribes can adapt and implement similar strategies. This not only saves time, but also builds a sense of unity and shared purpose. Reliable infrastructure is critical for supporting ongoing research and public health efforts. This includes funding for modern data systems, laboratories, and accessible technology. For example, investing in electronic health record (EHR) systems tailored to tribal needs ensures that data collection and analysis are efficient and culturally appropriate. Similarly, equipping clinics with telehealth technology can address geographic isolation and expand access to care. Celebrating successes, big and small, inspires continued collaboration and innovation. Recognizing achievements reinforces the value of partnerships and motivates stakeholders to stay engaged. For example, highlighting successful telehealth initiatives during tribal health conferences not only celebrates progress, but also encourages other tribes to adopt similar solutions. To summarize, epidemiology empowers tribes in the Great Plains area to address public health challenges by providing timely, accurate, and useful data. Building research capacity requires collaboration, cultural appropriateness, and community ownership. Training tribal members ensures sustainability and alignment with local priorities. Finally, effective partnerships strengthen public health efforts and promote self-determination. By working together, we can create healthier, more resilient communities. Now it's time to take action. As individuals and organizations, we have a responsibility to support tribes in achieving public health excellence. Commit to helping tribes access and use data effectively. Advocate for funding and resources to build research capacity. Strengthen partnerships by practicing cultural humility, maintaining transparency, and aligning with tribal priorities. To deepen your understanding, explore these resources. The National Indian Health Board, NIHB, provides advocacy and policy guidance. The Indian Health Service, IHS Epidemiology program, offers tools and training. The CDC Tribal Health Resources page highlights best practices and case studies. Together, we can contribute to the growth of public health and epidemiological capacity in the Great Plains area. Let's work hand in hand to create healthier, more resilient communities. Here are our references. Thank you for listening to this presentation.